An unnerving aspect of the coronavirus, there isn't a vaccine.
Yeah, there has been a conversation, I'm sure you heard this over the past couple of days, about an anti-malaria drug that's being helpful, but now that drug, they're in shorter supply and it's affecting a number of other people. Whitney Harding is live with what Ohio is doing to make sure that the patients who need that drug or those drugs will get them. Whitney.
That's right. The Ohio Board of Pharmacy had an emergency conference call yesterday. One item on the table, how to prevent stockpiling of that anti-malarial drug hydroxychloroquine. And after a major increase in prescriptions. It's a drug you've probably heard a lot about in recent days. Hydroxychloroquine, a medicine used to treat several forms of malaria.
I think it's going to be very exciting. I think it could be a game changer and maybe not.
President Donald Trump has talked about the anti-malarial as a possible coronavirus treatment during his briefings. Trials are underway, but there are still a lot of unknowns.
The scientists are not sure. It was seen as promising, and really it was supposed to be used in these life and death circumstances when we really are out of things to try.
We're going to know very soon, and I can tell you the FDA is working very hard to get it out.
Recently, the number of prescriptions for hydroxychloroquine has rapidly increased, and that's a problem. The drug is also used to treat rheumatoid arthritis and lupus, and suddenly those patients are struggling to get their medicine.
They will have deterioration if they cannot use this drug. There is a shortage, and we really need to use this judiciously.
Sunday morning, the Ohio Board of Pharmacy had an emergency conference call to try to slow down prescribing the anti-malarial to prevent stockpiling.
The vote is 7-0 to passing Modified Rule 4729-5-30.02.
Now, to get a prescription of the drug for COVID-19 reasons, a patient would need a confirmed positive test documented on the prescription and would be limited to no more than a 14-day supply.
It is not preventive. It is not going to keep you from getting this. It's really important that we're thoughtful about our drug supply. Fellow physicians, primary care folks out there, let's be really wise about this.
Now, for those of you who use the medication for its other uses, you will still be able to get it with your typical prescription. Live in downtown Columbus, local for you, Whitney Harding, NBC4.